So poverty and poor health. So I'm the Chief Executive of MidCentral District Health Board. Our District Health Board has a wide geographic spread. So you can think about Kapiti, Horowhenua, Tararua, Wairarapa, and of course Manawatu. So very big populations. As Margaret said at the beginning, I've been back in New Zealand for a year, and previous to that 15 years in Melbourne. But one of the things that really excited me about coming to MidCentral District Health Board was the opportunity to be part of a community of the size that we look after. So whilst it's a wide geographic area and we certainly have challenges around equity, we do not have equitable outcomes across our population. It's a population of 160,000, and I knew that we could put our hands around that community and know who that community is. The youth challenge us, I guess, about a vision, and it's easy to sit and listen to some of this and sort of think, wow, this is depressing, isn't it? But what's our vision? Why are we tackling poverty? And I like to think it's because we want a healthy, flourishing and prosperous New Zealand for our future. So that's my vision for New Zealand. Quality living, healthy lives, well communities. We are not the District Health Board of sick people. We stand for quality living, healthy lives and well communities, and that's what we're going to be focusing on into the future. And so this conversation about poverty is actually very much one that I want to be having. So poverty and poor health are inseparable. Poverty leads to poor health, but also results from poor health. So if we're going to improve health, then that can assist in creating a pathway out of poverty. So this community that I want to put my arms around, actually, we need to use data and information to understand who are the at-risk individuals, families or groups of people in our population that we need to actually focus on. We need a strengths-based approach to this. I don't use the word vulnerable. I think I used it about 3 times before the head of Te Tihi, the local whana ora collective Mataroa, said to me, Kath, don't use that word. So I don't use that, although I did have to say, what should I use instead? So now I use at risk. I don't talk about vulnerable because it's about strengths-based approaches. It's about partnering with individuals, with whānau and with populations, co-designing the solutions together. So what's going to work? I remember very early on going and talking to some of the people in one of our iwi-based health services who said, we were talking actually about the strengthening families and the child health teams in Horowhenua. And they said, oh, we've had education up here today. We're going to give that money back. We've told them we don't want that money. We don't want that money because they said that we have to do it this way. And we have to bring the children into this clinic. And that's not going to work. That doesn't work for us. It's not what whānau want. They can have their money. And unfortunately, that happens all too often. And I don't want to be one of those people in our District Health Board that thinks that we know what's best for individuals or the community either. So we want to partner and we want those people to tell us what's going to work on the ground. Ensuring that everything that we do together across all of our social agencies is working and that those people are at the centre. There's one word I've grown to really dislike. It's the word pilot. Why do I dislike pilot? Because I kind of think about pilot now, it's become synonymous with we're going to start something and we're going to stop something. Yeah. Actually. And I really don't like, that start something and that stop something. So actually we've got to rigorously measure and evaluate investment benefits to support a case for ongoing investment and sustainable change. We won't always get it right first time. It's about creating virtuous cycles of improvement. So we keep trying and we tweak and we tweak and we tweak, but we don't stop and start unless it's so wrong that we actually do need to stop. But I don't want to talk about pilots too much. So those are my 3 things, but I had a few other things that I wanted just to talk about because I talked about how poverty can lead to poor health. And how is that? And there's some real challenges for me as a Chief Executive of our local District Health Board. I know that for many people in this community, actually getting to a doctor is unaffordable. Going to an after-hours doctor is unaffordable. High costs of medicine, so the prescriptions that go into the rubbish bin because people actually can't afford to get the medicines that they need. That's a real issue, and we want to think about how we can resolve that challenge. We have very low cost access clinics. and there's a bit of a debate around this at the moment, what we actually need is healthcare for not that it is focused around populations or clinics, but about people. Access to nutritious food, so food literacy. So we do, again, we have, you know, a lot of good programs. We have food in some of our low decile schools, but again, it should be about individuals and families, not about postcodes. So we need to think about how we help people to access nutritious and helping people, I guess, to understand what nutritious food is. And I love programs that we have on marae and in schools where kids are learning how to grow food and cook food and what that means to them and bringing that home. It's fantastic. We all know about adequate housing. We know that we've, you know, had an issue with cold, damp housing. Again, we've got some communities where we've done an awful amount to, I shouldn't say the word awful, but we've done a lot to actually support, you know, warm, dry houses. But actually, you know, I talk to families where that's not the issue. We have got some families living in houses, lots of families in one home, maybe one set of sheets, maybe one towel. They can't actually wash the kids' clothes because they can't actually get access to a washing machine. And these are families who've got kids and adults in their homes with terrible skin problems. We cannot tackle those skin problems when we've got families that only have one set of sheets and cannot actually wash that set of sheets. So it's very fundamentally, you know, basic. And I won't talk about education because others are going to do that much better than me. So those are things that actually impact on people's health. And of course, health can impact and lead to poverty. So what is that? So if you're experiencing a chronic, complex mental health problem, you're unlikely to be able to be in employment, and all of the issues around housing and affordability come to the fore. And other chronic diseases like diabetes and heart failure, particular issues, licit and illicit substance use, a significant issue in the community, disability, that hasn't gone away, and of course all the issues of social isolation, anxiety and depression. So these are things actually that can take people into poverty, and we've got to remember it's a two-way thing here. So I did want to talk about that. So I'm all about health, actually. So this is very health focused. I was really sad when I got the flyer for the workshop and I saw the signpost. I was looking for health on the signpost. I wanted to see health on that signpost because I think health is absolutely, as it says, crucial. So as good health is crucial to protect the family from poverty, so better health is central to poverty reduction. Improving the health of the poor must become a priority, not only for public health, but also for other sectors, economic, environmental and social. And so that's come from Dying for Change, which is the World Health Organisation, the World Bank, and Voices of the Poor, a report that they put out not too long ago. So please do today think about health and keep health at the centre of your thinking, because unless we tackle issues around health and well-being, that goes along with it, very important to bring those two words together, then we're going to not be able to tackle the challenges that are in front of us